Welcome to The Explainer. Today, we're digging into two huge healthcare models that grew out of one single revolutionary idea right in the middle of World War II. An idea that wasn't just about health, but about rebuilding society itself from the ground up.
So here's the game plan. First, we'll check out that original historical blueprint. Then, we'll see how it actually got built in the UK and in Canada. After that, we're going to bust a few common myths about these systems, and finally, we'll wrap up by looking at what it all means for us right now. All right, let's dive in. I want you to picture this. It's 1942. Britain is right in the thick of the Second World War. But even with all that going on, the government is already thinking about what comes next, about the peace. And that forward thinking led to a moment that would change everything. So this civil servant, Sir William Beveridge, gets what sounds like a pretty dry assignment: write a report on social insurance. But he didn't just do his job. He went way, way beyond. He decided this wasn't a time for small fixes. Instead of just patching up the old system, he laid out a grand vision to completely remake British society. His report famously identified 5 giants holding society back: want, disease, ignorance, squalor, and idleness. And his plan wasn't just a healthcare plan or an unemployment plan. No, it was this massive, coordinated attack designed to slay all 5 of these giants at once. So, a brilliant blueprint is one thing, but how do you turn it into reality? Well, let's look at the very first and most direct result of his vision for fighting the giant of disease: the UK's National Health Service. You know it as the NHS. Okay, so the structure here is absolutely key. The Beveridge model you see in the UK is what you'd call true socialized medicine. The government isn't just the insurance company that pays the bills, it actually runs the whole show. It owns the hospitals. The doctors are government employees. It is both the payer and the provider. And you can really see how this works when you follow the money. Look at this chart. A whopping 84% of all healthcare spending in the UK is public money, paid for through taxes. And what that means for people is that pretty much everything, from a checkup to a major surgery, is totally free when you need it. You just walk in. But, and this is a big but, every system has trade-offs. The UK system is amazingly efficient with money. It spends just over 9% of its economy on health. But to keep costs that low, you've got to make tough choices. These aren't just numbers on a spreadsheet. They're constant debates about priorities. And that can mean things like being a bit slower to get the newest, shiniest medical tech, and yes, sometimes having longer wait times for certain procedures. Okay, so that's how the UK did it. Now let's jump across the Atlantic and see how Canada took that exact same core principle of universal care, but ended up building a completely different system. This is the National Health Insurance model, but you probably know it as single payer. The idea here is that the government is the one single payer for everybody's essential medical care. It's like one giant public insurance plan. But, and this is the key difference, the people actually providing the care, the doctors and the hospitals, are mostly privately owned and run. And this chart really makes that difference clear. Public money still pays for the vast majority of care, about 70%. But see that much bigger slice for private spending? That 30% covers things the main public plan doesn't, like most prescription drugs, trips to the dentist, and getting new glasses.
You know, whenever you talk about systems like this, especially next to a country with a totally different approach, a lot of myths start flying around. So, let's do a little myth busting, using the Canadian system as our main example. First up is the big one. You hear it all the time. Wait times in Canada are so bad that people are just giving up and fleeing to the US for treatment. Well, the data just doesn't back that up, not even close. One of the biggest studies on this dug deep, and the results were pretty shocking. Out of 18,000 Canadians they surveyed, only 90 had gone to the US for care. The number is just incredibly small. So yeah, that one's a myth. Okay, fine. What about the doctors? The other big myth is that doctors are all packing their bags and leaving Canada for bigger paychecks in the States, right? Actually, it's the complete opposite. Now, there was a time back in the 90s when some doctors did leave, but that trend totally flipped. For almost 20 years now, Canada has consistently had more doctors moving in than moving out. So that's myth number 2, busted. All right, for our final section, let's zoom back out. Let's return to those 5 giants that Beveridge identified back in the 1940s and ask a simple question: what do they look like in the 21st century? Remember these guys? The whole vision was to build a system that could defeat them once and for all. Beveridge was way ahead of his time. He understood what we now call the social determinants of health. He knew that your health isn't just about healthcare. It's tied to your job, your house, your education.
And many would argue those giants were never really defeated. They just changed their shape.
Take want, which is basically poverty. In Beveridge's era, that mostly meant you didn't have a job. Today, that giant looks very different. It looks like having a job, maybe even two, and still not making enough money to get by.
And this is the part that's just staggering. For the first time, the majority of people living in poverty are in families where someone is working. Think about that. The fundamental promise that a job is your ticket out of poverty, for millions of people, that promise has been broken.
And the other giants? They've all put on modern costumes. Disease today is less about infectious outbreaks and more about deep health inequality, where your zip code can determine your life expectancy. Squalor isn't old-school slums, it's the modern housing crisis. Idleness isn't just unemployment lines, it's the constant insecurity of the gig economy. And ignorance has morphed into educational inequality, where a great education feels less like a right and more like something you have to buy.
Which brings us to our final thought. The Beveridge Report was revolutionary because it was a bold, tailored solution for the problems of its day. It wasn't about patching things up, it was about designing a whole new world. And that leaves us with a really big question. If we were to be that revolutionary today, what would a blueprint for tackling the giants of our time even look like?